I've covered this a lot before, but it's still new to new parents. Bilirubins, meningitis, phototherapy, and now going into global delays. Okay. You were there to save your baby. And that's number one. There's no going back. There's no doing anything that I'm saying here is not, oh, I shouldn't have done it. But you have to, what doctors and hospitals don't tell you, that there's movement consequences, especially to infection, to bilirubins, and why. So I work on this quite often. First of all, what needs to be done, first of all, I don't care if your baby's 5 months old, the newborn movement assessment. You need to know where your child is at for movement. Right now, your child cannot produce the movements that you're looking for in the newborn movement assessment because there's nothing here within the chest. Also, what's happening is that the inflammation from the kidneys, you need to know if you've got movement throughout there. Like I'm working with this little munchkin that now comes in from Atlanta, but the second I touch, she's just sitting on my table. She's 7 months old, and I was just like, oh, she phototherapy. And they're like, how did you know that? And I'm like, because the kidneys get inflamed, right? And they push back on the rib cage and into the spine, and it really creates a lack of movement. You also had transfusions. So on top of that, that means you have platelets drop in levels. Again, the dead blood, and I don't mean to get graphic, but this is just what it is. I went through this just now with Erin, with her baby needing 4 transfusions in the hospital. But the platelets, the blood dying at that rate makes the pelvis very heavy, right? So you have that. Now you have phototherapy. Now, depending on the phototherapy, they used to do it just gauze on the eyes, but now they're putting these full-on helmets. Cranial movements are meant to happen until your baby is walking, but when they reduce the movements in the cranial area, it's very hard for a child, especially to come to sitting, because this temporal bone, and I know this is an adult body, but just to show you the different colors, but when a baby, you can see it on the baby, but it's just, you know, the baby you can't see as well. But when their baby is coming to sitting, right, these bones, this is why they're so subluxed. It's not just to get them out of the vaginal canal, but this subluxation is actually like almost like a little baby catapult, and it will help a child come to sitting. But when the cranium movements are impeded, which they had to save your baby's life, I'm not saying anything was bad, but we've got to undo it. And then on top of that, you had meningitis. Infections are my baby. So when you're looking at, and again, this is just simple physics, right? But when you're looking at, when I go to move, right, there's weight transfer. When I have weight transfer, you can see that water keeps its horizon, right? But it just really doesn't take a lot of weight. But if I take this same volume and put it this way, right, now this is heavy. It's the same, and so when I go to pick up, you can see again, look at the amount of movement that's in there. That's not right. However, when you have infection, what also happens is it changes the mucosal flow rate. The mucus in babies is real thin. It just pours out of their nose and their mouths, and eventually, as a child gets a vestibular system, they stop to drool. Doesn't matter if you're drunk, you've taken drugs. If you have an impaired vestibular system, you can tell because the drool is automatic, unless you're like really teething. So, but again, you have an impaired vestibular system, you've got drool. But the infection, but this drool is meant to, again, through the nasal cavities, you have a nice thin liquid. So anytime that's why tummy time and all these things are very important. But your child was in the NICU versus getting the tummy time right away. So the nasal cavities and all that are not getting coated like they should for movement. And now you've got this, and it's even if they're moving, just see how this liquid is slower, right? It's not only that it's heavier, so it changes off the weight transfer dynamics in the baby's body, but it's heavier. Guys, this is where I know it's overwhelming. You've got to learn to do this work. This work is there for your baby and for your baby to start moving. And now on top of that, your child's not even ready for sitting, and you've got some therapists saying sit them up to break the hip. No, that's not how. If you can't move in and out of a position, right, you're not learning. If you're not going in and out of standing, you're not walking, right? If you're not going in and out of all fours, you're not crawling on a 4 point. You're going to roll over and all of that kind of stuff. versus getting up that way, right? So, you know, that's kind of thing like this. So this is not sitting. Your child is unable to sit, doesn't have a pubic bone strike. Please, we don't even have rolling over yet. You've got to go back. First of all, I want you to do the breathing course. I know your child can breathe now, but your child went through medical attention, and we need to get that movement going through, and I need to get the back of the ribs moving again, because we had the bilirubin, but we also had meningitis. When you pick up your baby, you should feel a nice weight transfer. It's not there. I'm going to tell you that now. My son had Haemophilus influenza and staph and RSV. We've had a lot of, he's also been sepsis, preseptal. I know about infections. So all of this, and I'm telling you right now, it's being taught in the tummy time course. You're going to start on the fast start. You've got to go back to square one. And even here, you know, and it's better on your chest. I teach that in the course. You're just looking for these nice, gentle movements through here, which will get into rolling over, which will get into the grabbing your feet. But you've missed every milestone. We're not into sitting. I'm sorry to be harsh, but it's not good for your baby. Your baby is now flexing and so forth because it doesn't know how to move. It's going to start throwing tone, and that's what tone is. I don't know what to do, so I'm just going to throw something out there to prevent a fall, and these things shouldn't be in your child's vocabulary of falling or static or anything like that. And that's what you've got to work with first. It's very, very important, but it's necessary, and you're going to start with tummy time and go from there. But your child is just too heavy to move due to the infection. I've got some other videos that I've done with stuff like this, again, because that's how I got into this work, because my son's infection. My son was perfectly fine one day, and he was gone the next. And so they said he'd never walk or talk again. He's about to graduate from ASU. So, and he's minoring in Russian, the kid who wasn't supposed to talk. But I'm not saying that as a brag, guys. The only reason I did this work is because I had to save my son. And I know it's overwhelming, and you didn't plan on any of this happening, but you've got to start today. And I really mean this for a lot more of you. You've got to start today. I know I don't know where to go. I don't know what to do. I'm not here to get you to learn movement lesson. I'm here to teach you how to help your child develop. And that's all you're thinking about. Today's tummy time. Today's breathing, and go from there. So hierarchy, breathing course first. Maybe you have to spend a couple of days into tummy time, and we can go from there and build up into rolling over. I want a follow-up video within 2 weeks, because I need to see what's going on. Thanks. Bye.